guys, so some of you have hopped on that video that I did with the hands-on like facial jaw neck massage for the self, but we're going to use the Coregeous Ball as another tool it's not as much of like the fingers and the deeper, little bit firmer therapy balls that you would have the impact so much so on the muscular tissue, but you will have an impact with this guy on the like this more subtle layers of the body. So the nervous system is a really big one. Sometimes with the harder pressure with the fingers and even like a therapy ball, it can feel really good to go into those deeper places for the like muscular tension. But sometimes it can be too much for the nervous system and it can kind of protect and harden more. So this is a good tool that you can use for releasing the neck and having a really kind of calming effect on the face, the brain, the jaw, the rest of the body. So I'm gonna do this upright just so that you can see me. I would recommend doing this on your back, and I'll show you a couple of the moves that I would do on my back, but I just want you to make sure that you can see me clearly. I've got in the front, I have my trachea, so it's basically where I'm breathing, so the trachea comes down and attaches into my lungs. Behind that is another tube that's your esophagus. The esophagus rests right up along the front of the spine, and ideally that's going to glide and slide that tube. Those tubes are going to have mobility around them a little bit, so that everything's functioning well. From our lifestyle of looking forward down, looking at our phones, computers, driving in our cars, whatever it is, these tubes can get kind of compressed. So one thing is that we can strengthen them. We can strengthen those deep flexors, the muscles that support the tubes, and the brain, jaw, everything. But we can also do release work, and sometimes doing the release work before we do the strengthening work is more effective because the body has something new to work with. So rather than like old tensions in the body. So let's go directly onto, not directly onto the tube, just lateral of it, tubes. And I'm just gonna take the skin of the Coregeous Ball, I'm gonna push pressure in. When you push pressure in and you're doing this on yourself, just be mindful of not trying to like crunch your shoulders and push it in. It's like relax the shoulders, let this kind of melt in, and you're just gonna let the skin of the ball grab the skin on your neck. Okay, so I'm gonna just do a little spin move here. So you're gonna pin in, and as I twist, you're gonna rotate your face head away from the ball. And breathe. Trying to keep my jaw really relaxed. And then going the other way. Breathe. So again, doing this on your back, you have these baroreceptors that sense pressure in your neck, right up along where we are. It's going to feel probably even more relaxing to do this on your back. Okay, I'm going to go up, right up behind my ear, my jaw area, kind of pin in. And as I do this is just like what we did with the hands-on massage. I'm just taking the tissue, tacking in, and then spinning. I breathe when I find tension, I exhale, soften. Once again, rotation. And this can like look super weird, but who cares? Go to the next side. And you can totally go like back on the back and side of your neck. You don't have to stick in like one particular area that I'm going to, but good to just explore your body, feel where you're holding your unique tension, and then see what you can do to help yourself out and give yourself a little more breathing room, literally. That feels really good on me. I'm just gonna add some motion on, because I'm just tacked into the tissue. I'm trying to keep my shoulders pretty mellow and relaxed. And then So that's the neck. You can go all around the face. You can rub this all over the face. It's the same technique. You can pin into the tissue. You can, as you pin, you can rotate as you're just kind of pinning it down. You can go up and down, see how that tissue stretches when I do that. And you can also rotate it into your body, and you can add movement on from the bones of the mouth. So with my lower jaw, I'm going to open wide as I stay pinned in. Spin more for me, I just want more spin. And then as I exhale, I'm going to gently close my jaw. Harder to do when you're talking. So, but just so you get the gist, so you can go to the other side, you can take this on your forehead and kind of have the skin of the ball grab the forehead and push up. You can rotate that space between the eyes. Is really just more exploratory of the tissue tension. And because the tissue of the neck is, like, there's so many layers and so many intricacies of structures in there, that you don't need a really like intense tool, and you can have a really deep impact on the nervous system, how you're kind of like, your vision can have an impact on that. Okay, so next one, we're gonna go to the back of the neck. As I said, I would have done all of that on my back if I weren't videoing for you. And then just make sure, girls, with your hair, like mine right now, it's kind of not the best position. So I'm going to go right to that suboccipital space, so the space where my neck and my head come together. Right underneath the skull there, we've got something called like it's a myodural junction. So it's basically where the muscle and the dura mater around the brain, it's basically like you're covering around the brain that covers all the nerves as well. There's a connection, there's an overlap right here where I'm at. So I'm just gonna let that ball kind of melt into the cervical spine, that curve of the cervical spine, but more specifically, I'm gonna focus a little higher on my neck. I'm just gonna try to let this lower jaw totally relax. I'm gonna inhale. Exhale. So you can do this if your arms are out by the sides. Let your shoulders get as heavy as possible. If this feels kind of ungrounding for you and you just kind of feel like you're not getting it, this is not going to be, again, it's not going to be an intense massage kind of thing. This is on the deeper impact of like the craniosacral rhythm, the neural tension around the eyes, the back of the head, the jaw. This is going to help soften some of that. So take the hands maybe on the body if it feels too exposed here. You take the hands on the body for some grounding. You could also, if you have sandbags at home, you can put sandbags on your belly, blanket. You just wanna really allow your body to feel safe and secure and stable as possible as you do this work. It'll help to kind of send a message to the body that it's like, we don't need to protect right now. We definitely all need a conscious cue of safety right now. So conscious cue of it is safe to relax completely. And I'm just gonna gently, I'm gonna shake my head no, actually that feels good. Just little pockets of tension there. So it's kind of like a nice fluffy little pillow that you're just letting your head drape onto. And then you can add little micro movements on if it feels good, but the movements are not big. All my attention is in the back of my head, so that it's almost like the back of my head is creating the movement. I'm not trying to do these big jutting movements with my chin. I'm trying to move just really gently and slowly. And then again, we're going to focus on the breath. So as I inhale, my head follows a particular movement, and then I exhale, my head does probably something else. Inhale into the belly. Exhale, let it empty. Inhale. Exhale. So just this really gentle rocking of my head and my neck. You can do this for anywhere from like 2 to 5 to 10 minutes. Once you are done, you'll remove the ball, gently place the head down. And I want my hair out of this thing now. And once you're just trying to let the very base of the skull feel like it's like sinking into this nice cradled position. Letting the neck and the throat, the tubes of the throat soften back. And then as you breathe in, no tension in the tongue, the neck, the throat. As you inhale, just let the whole torso fill without tension in the upper body. Pause, exhale completely. Relax the tongue. Inhale for 3, 2, 1. Pause. Exhale for 5, 4, 3, 2, 1. Pause. Inhaling for 4, 3, 2, 1. Pause. Exhaling for 6, 5, 4, 3, 2, 1. Pause. Normal inhale. Normal exhale. Draw your attention to the very top of your skull and the very base of your pelvis, so that you just kind of feel this container. As you inhale, feel expansion between those two domes, the pelvis and the crown of the head. And as you exhale, feel the two domes getting closer together, closer together, closer together. Inhaling, feel the domes expand away from each other, more space, more space. And as you exhale on this next one, imagine the sides of the whole container getting closer together, closer together, closer together. Inhale, feel your whole container expand. Exhale, feel your whole container gently hug in, get smaller, get smaller, get smaller. And then let it go. Normal breath. Rest the hands on the body or on the floor and just observe. So that is the basics with the Coregeous Ball. We've got the pelvis, the chest, rib cage area, the head, neck, face. I'm feeling pretty good right now. I will have some more things that you can do with the Coregeous Ball coming up, as well as with the massage therapy balls. So stay tuned on that.